called as.
Next.
Okay, next is Paril Satwani. Yes. Regression of mild myopia using extended blinking therapy.
Extended blinking therapy. What's that? What?
Good afternoon, everyone. My topic is the regression of mild myopia using extended blinking therapy. So, myopia, also known as nearsightedness, affects all the age groups starting from early childhood, and nearly 22% of the world's population is affected by myopia. Myopia, along with its progression, is a global pandemic today, as described by WHO, and by 2050, more than 50% of the world's population is going to get affected by its myopia and its vision-threatening consequences. Various methods like glasses, contact lenses, drugs, and exercises have been tried to halt the progression of myopia. So we conducted a prospective comparative study in a tertiary care hospital in eastern India. We included mild myopic patients with spherical equivalent of less than -3 diopters between the age group of 11 to 40 years, and we excluded all the patients with any known ocular or systemic diseases. These patients were divided into two groups, Group A and B, with 40 participants in each group, and Group A was given extended blinking exercises. Group B was given conventional treatment, that was glasses. After 6 weeks, visual acuity, spherical equivalent, and biometry was observed in both the groups, and results were analyzed. So, extended blinking exercises, we asked the patient to open the eyes and look at a distant object for 5 seconds, and then gently close the eyes for the next 5 seconds, and then again open the eyes for the next 5 seconds. And we asked the patient to repeat this cycle for 5 minutes in the morning and 5 minutes in the evening. And these were the results that we got. In Group A, logmar visual acuity, the mean logmar visual acuity was found to be 0.280, that reduced to 0.070, and spherical equivalent was found to be -0.7, that reduced to -0.2 in the right eye. In left eye, same logmar visual acuity mean was 0.298, that reduced to 0.063, and spherical equivalent was -0.6, that reduced to -0.2. There were no changes in keratometry or axial length values, which was, and in Group A it was found to be statistically significant. Group B, there were no significant changes noted. So here we have in Group A an improved visual acuity and reduced spherical equivalent, and in Group B no changes were seen. In our study, there were no changes in the biometric parameters following blinking therapy. That suggests that there may be some other factors contributing to the improved visual acuity, such as increased retinal function or sensitivity. Various methods may be attributing to this improved visual acuity observed after blinking exercises. One of these, as given in previous studies, is that after exercises, anterior chamber angle increases, that causes changes in iris configuration. This ultimately changes retinal thickness, causing structural remodeling that helps forming a clear image on retina. As the function of the retina improves, it leads to decreased refractive power and spherical equivalent. Another mechanism attributing to this improved visual acuity can be improvement in the near point of convergence. Along with this, it helps reducing eye fatigue and affect convergence-related binocular vision function improvement that causes reduction in the eye fatigue. With significantly positive findings in our pilot study, we aim to study further on a larger sample size, including various grades of refractive errors, and to investigate and analyze changes in the retinal parameters. From our study, we conclude that blinking exercises is a cost-effective strategy in halting the progression of myopia at an early stage, thereby helps regression of mild myopia and decreasing the burden of myopia in our population. Since the burden of myopia in young children is increasing day by day, we would like to find out ways to prevent its progression in cost-effective and simple ways. Thank you.
Thank you. I have a question for you. You mentioned that you divided your population, study population,
Yes,
into
ma'am.
two groups, 40-40.
Yes, ma'am.
But the second group, you didn't do anything specific to halt the progression of myopia. All you did was give them conventional
Glasses, yes,
So
ma'am.
then where is the comparison? Because
Ma'am.
here you are actively doing something, you're doing blinking exercises
Yes, ma'am.
to halt the progression of myopia. But we all know that just giving glasses is not going to halt the
Yes,
progression
ma'am.
of myopia. You did not put them on low dose atropine or anything else, contact lenses
Yes,
for that
ma'am.
matter. So then does your study stand ground?
Yeah, that's the control actually.
Yeah,
Yeah.
you need a control.
Yeah.
That is the control.
That's the control.
Group B is the control.
It's a control, but then the control needs to be comparative, not just conventional glasses.
Yeah, just could you explain a bit more
About
how you use the term using extended blinking therapy? How do you do that? Extended blinking therapy.
Five
What
minutes,
exactly?
5 minutes.
Sir, extended blinking therapy is the form of exercises that we have given to the patients. In that, we'll ask the patient to look at a distant object for like 5 seconds, opening the eyes for 5 seconds, then closing the eyes for the next 5 seconds, and then again opening the eyes for the 5 seconds. Basically, we are promoting
how
the
long-
complete
how-
blinking
5 and 5.
For 5 minutes.
Oh,
that
for
is-
5
Morning and
minutes in
evening.
the morning and 5 minutes in the evening, sir.
This
Twice.
is the same like some alternative
Cupping.
medicine people using palming.
Palming,
No,
palming, right. I was just
They
going to
uses
say
palming, and Second World War, actually First World War, Japanese soldiers, they used to put a sandbag on the eyes in the night time so that they can fight in the daytime because they get it. But here there is no axial and difference.
Yes, sir. There were no biometric
but,
changes seen. We would like to further. We would like to study for how like these
but
changes.
you have
No.
explained it with so many theories.
Yes, sir.
but
There
what-
were many
what is-
articles that were suggesting that yogic exercise
so this is a yogic exercise basically.
and blinking. Ma'am, we have modified it. Like yogic exercises will include the movement of the recti muscles and these like extra.
But here there is no yogic exercise.
No, no,
It's
ma'am.
only blinking.
Yes, ma'am.
Is this documented? Is this a documented?
Ma'am,
way?
we've seen that blinking helps in digital eye strain, and that causes a good improvement in the quality of vision. So we were trying to see whether it is helping to.
Who came up with this idea in your department? I would like to know.
And when you do the therapy, who actually takes with the stopwatch? Do you
Yeah.
do yourself or the patient?
Or do you leave it
just
to the
5
patient?
seconds?
Ma'am,
No, who looks after that
we
5 seconds?
explained the patient as to.
And then left it to them.
Yes.
So then how did you control it? There was no control from your part. It was what the patient was doing at home. He may have done it, he may not have done
Okay.
it. How do you know?
Ma'am, actually, like next in my thesis also we have
No,
taken.
they're not talking about what you're going to do next. In this study, what you have done. So, there has been no clinical record on your part to see whether they have really done the exercises for that many minutes, morning and evening. It has been left to the discretion of the patient and the attendant to do it, isn't it?
Yes, ma'am.
Okay, thank you.
Thank you.
Thank you.